Welcome back to WHDT World News. Our guest today, Robert Scott Bell, we're discussing the health of the gastrointestinal tract. Robert, colostomy bags, they're not a very pretty sight, and they require a lot of maintenance. There's a lot of risks to them. How common is the colostomy surgery?
Well, unfortunately, I think even one colostomy surgery resulting in it is too much. But of course, my perspective as a holistic healthcare provider is a little different, especially when I understand that modern medicine and its interventions actually have caused the perceived necessity of pulling out parts of the colon or intestine. And I just find it abhorrent and barbaric. So when I was approached many years ago, in fact, with teenagers, I mean teenagers that had already had the surgery, I knew it was a disaster that had already happened, and we really needed to re-look at the GI tract and the reason for these ailments. We've discussed some of them already, but the idea of just pulling out body parts is something that is, again, we'll look back on it and say, yes, we lived in a barbaric era with all our technological advancements. And the simplicity with which we can recover integrity is extraordinary, but it is pretty low tech. It's non-invasive, although we'll bring certain things into the system that will restore the integrity, including the reliance on something that even modern medicine is acknowledging now is very important, the use of prebiotics and probiotics.
Let's talk about that. What antibiotics, everybody's heard those, but probiotics and prebiotics, what exactly are those?
Well, this is the floral presence within the GI tract. Again, we have bacteria. In fact, more bacterial cells than we have human or mammalian cells in our entire body within that GI tract. And it is the seat of immunity. We talked about the seat of digestion. 70% or so of our immune cells or system is right there in the GI tract. So when we disrupt that ecology, we actually set the stage for all kinds of aberrant metabolic functions to occur or dysfunctions to occur, including an inability to digest like we are designed to do. So we can't assimilate things, or the inability to defend against certain things that may be down there or may be introduced that normally would not get into the blood or the lymph that now have open access because of what we talked about, the leaky gut as well. But we also have the ability to detoxify and excrete that is minimized because of the overgrowth of certain bacteria. So the probiotics are the acknowledged beneficial bacteria that are reintroduced via supplementation or fermented and cultured foods that have been used for thousands of years to repopulate the gastrointestinal tract. But unfortunately, it's not as simple as just throwing the good guys back in. I want you to imagine if you have been designed with a rainforest in your gut with villi that protrude from the epithelial lining of the gut, and you've wiped the villi out, you've damaged it to the point where it no longer resembles a rainforest, it looks more like a desert. And you throw good guys, bacteria down there that are designed to live there, they get there and they say, hey, what are you doing? We don't live in the desert. Where's the rainforest? And unfortunately, even all the good guys you throw in will go right through and not situate. So my goal is to restore integrity to the lining, to restore the healthy forest down there so that when we put the probiotic bacteria in, they actually have a place to resituate, habitate, live, grow, restore immunity, restore digestion, and detoxification.
What's causing the stripping of those good bacteria from the system?
Well, we've talked about antibiotics and vaccines already. We've got to talk about heavy metals. We've got to discuss the pesticide residues coming from food that's not organically grown, herbicides, fungicides, GMOs you mentioned as well. We've got plastifiers. We've got so many synthetic chemical compounds, additives, preservatives, colorings, flavorings that are all harmful to the microflora down there, as well as pro-inflammatory to the lining of the gut. So if you don't understand this, you're literally with every meal inflaming your system, like you said earlier. The reason why people were reaching for Tums and Rolaids instead of listening to their body say you need to eat differently, you're just suppressing and putting out a fire that's being caused by the very thing that you're doing.
So would putting these probiotics in the system, obviously it would make the gut more healthy, but would it also eventually prevent the ultimate use of a colostomy bag?
It could, but I have a strategy that I think is much more important or equally important as promoting the good flora. What we want to do, if you think about wound care, healing the wound. What can we do inside the body with those wounds? And I mentioned something on a previous interview. We talked about a trace element called silver or silver hydrosol. And establishing the silver and driving it into the gut will downregulate inflammation, that chronic inflammation that never seems to go away, but it will simultaneously upregulate the healing of tissue and developing of new healthy epithelial cells, like we heal the skin topically. Silver is used in burn care centers in the guise of silver sulfadiazine, but we don't need to put a substance that is prescription in the system like this. We utilize a bioactive silver hydrosol available in most health food stores, along with aloe vera, a wonderful plant that heals as well and soothes. The silver aloe combination, I take about a couple of tablespoons for adult of each together, driving it into the gut 3 times a day over the span of 2, 4, 6, or maybe even 8 weeks in extreme circumstances. And we can heal the intestinal lining, regrow the forest, so that when we put the probiotics back in, they actually have a place to live. This is a remarkable new protocol that can bypass the perceived need of surgical intervention down the road. And it took me 2 years to recover when I was 24 years of age, just using homeopathic medicine, herbal medicine, and homeopathics, which I mentioned as well, supplements. The 2-year protocol is a lot longer than most Americans are willing to do. So this new revised additional protocol that I've helped to develop with silver and aloe can reduce that time frame from 2 years to as little as 2 months, or even sometimes less.
So, Robert, aloe and silver ingested regularly will help regrow the
lining,
the lining of the stomach as well. If you go to your average doctor, is this something that he would be knowledgeable about?
I would like to think so, but unfortunately, they're trained in drugs and pharmacology more than they're trained in understanding nutrients and minerals and their impact on metabolic function and regeneration. As I said, perhaps the irony is that silver is used in severe epithelial wound care and damage, like burn care centers, where they use it as a primary mechanism for eliminating infection, reducing inflammation, and accelerating tissue regrowth. But the concept here is utilizing a much more efficient and completely non-toxic form of silver and driving it into the area of need or the point of foci. And that's where that botanical aloe vera comes in, because it helps to carry this form of silver that I utilize. It's a major chapter in a book that I'm releasing very soon to bring this knowledge back to the medical, much less the lay community, because we've got so much gastrointestinal damage, so much leaky gut, colitis, and Crohn's and irritable bowel that we have got to. We must reverse course, or else we're going to have a population of people walking around with external colostomy bags, and that is not a good option.
Robert, you're in Florida, in the Orlando area. How could people communicate with you directly to get a better hands-on approach to some of these solutions you talk about?
Well, the best way is to go to my website, robertscottbell.com, and listen to my radio show 6 days a week, as you mentioned, through naturalnewsradio.com and Genesis. I have doctors that consult with me. I consult with them on tough patients. So I'm trying to train and teach everybody about these simple mechanisms and means and safe options for people to restore that gastrointestinal integrity, which again is the basis for good digestion, good elimination, and of course, good immunity.
All right, that was Robert Scott Bell right here on WHDT World News, keeping you healthy. We'll be right back with more. We've got weather, news, and Hollywood coming up after the break. Stay tuned.